I was a trauma surgeon. I had to call probably every 3 or 4 days. 24-hour shifts. No post-call days off. Working weekends. Never truly off because my patients were always my responsibility. And then I became a wound care physician. No nights, no weekends, no call. My life completely changed. Hello, I'm Dr. Felix Becker. And today we're having the conversation nobody wants to have, honestly. Lifestyle matters. And you need to decide what kind of life you want before you choose a specialty. Welcome to In Search of 42. Here's what they tell you in medical school about choosing a specialty. Follow your passion. Choose based on what interests you intellectually. Don't choose based on lifestyle. That's not what medicine is about. But here's what I'm going to tell you. That's bullshit. Lifestyle matters. It matters more than anyone wants to admit. Because your specialty doesn't just determine what you do at work. It also determines what kind of life you have outside of work. Whether you can have a family, whether you can have hobbies, whether you can have relationships, whether you can have any identity outside of being a doctor. And the dirty secret is that some specialties make having a life nearly impossible, while other specialties give you freedom and flexibility. Today, I'm going to give you the honest breakdown. The real talk about lifestyle across different specialties. Not the sanitized version you get from your advisors, not the propaganda from specialty interest groups. The truth, from someone who has lived on both ends of the spectrum. Let me tell you what high-intensity medicine looks like. When I was a trauma surgeon at St. Louis University, I took call about every 3 or 4 days. That means every 3 or 4 days, I was at the hospital for 24 hours straight, waiting for trauma activations, operating on patients, managing the ICU, teaching residents, running the trauma service. 24 hours. And unlike residency, there was no post-call day off. I still had to work the next day. Now, we were pretty good at St. Louis University about trying to lighten the load on the post-call person whenever possible. But you still had responsibilities. You still had patients. You still had to be there. We also took call and worked at least one weekend every month, sometimes two. So at least 1 weekend a month, I was spending 24 hours at the hospital, plus whatever time I needed to work post-call. And then I'd go home exhausted, shot, tired, not good for anything else, not present for my family, not able to enjoy my time off, just recovering enough to do it again in a few days. That's the reality of high-intensity medicine. And it takes a toll on your body, on your mind, on your relationships, on your life. Here's the part people don't talk about enough. Even when you're not on call, you're never truly off because your patients are still your responsibility. If you operate on someone and they have a complication 3 days later, that's your problem. Even if you're not working, even if you're on vacation, even if it's your kid's birthday, the patient is your responsibility. So you get phone calls, you get texts, you get paged at dinner, at family events, on weekends, on vacation, and you cannot ignore them because someone's life might depend on it. I still see a couple of private patients right now in wound care, and they message me any hour of the day or any day of the week when something happens. I don't necessarily mind because I'd rather know about complications or setbacks sooner rather than later, but it does interfere with family time a lot. You're never fully present. You're always half waiting for the phone to ring, and always half thinking about your patients, always on. That's high-intensity medicine. But I transitioned to wound care, and my life completely changed. No nights, no weekends, no call. I worked about 60 hours a week, which sounds like a lot, and it is, but it's 60 predictable hours, not 60 hours plus call, not 60 hours plus emergencies, not 60 hours plus being on call mentally all the time, just 60 hours. And I knew when those hours would be. I could plan my life. I could commit to family events. I could have hobbies. I could be present. Now, wound care has its own challenges. A lot of my time was clinic time or seeing patients in nursing homes and the associated drive time to and from those nursing homes. I had a lot of windshield time driving places, which wasn't a very efficient use of my time. But I was off at a reasonable hour. I had my evenings, I had my weekends, I had my life back. That's what a lifestyle specialty gives you. But let me be honest about the trade offs, because there are trade offs. Trauma is definitely more complex than wound care, more intellectually stimulating in many ways. You're dealing with life and death situations. You're doing complex surgeries. You're making split-second decisions. You're managing critically ill patients. That's engaging. That's challenging. That's what a lot of people go into medicine for. But you're also so tired most of the time that sometimes you don't even want to have those intellectual discussions about what should happen. You're too exhausted to appreciate the complexity. You're running on empty. In wound care, the cases are still complex. Chronic wounds are multifactorial. They require understanding of biology, pathophysiology, patient compliance, social determinants of health, but it's a different kind of complexity. It's not life or death. It's not adrenaline fueled. It's slower, more methodical. Some people find that boring. I find it sustainable. Here's the breakdown. High intensity specialties. You work more, you have more interesting cases, more complex procedures, life or death situations, and higher pay. In lifestyle specialties, the pay is less, but you have a lot more free time and a lot more ability to spend time with your family or have a life outside of medicine. That's the trade off. And you need to decide which side of that trade off matters more to you. Let's talk about the elephant in the room. There is stigma around choosing lifestyle specialties. Massive stigma. When I left trauma for wound care, I was definitely stigmatized. Wound care is where physicians' careers go to die. We're outcasts, the ones who couldn't make it somewhere else, the ones who weren't tough enough for the high intensity specialties, the ones who chose comfort over excellence. That's the narrative, at least. And it's bullshit, but it's real. Wound care is not yet a recognized specialty, even though it's a multi-billion-dollar industry, even though chronic wounds are a massive healthcare problem, even though it requires real expertise and skill. It is not recognized. Why? I think it's stigma for the most part, but the tides are slowly turning. There are starting to be recognized fellowships in this field. Podiatry has had wound care fellowships for many years already, but for physicians, we are still fighting for recognition. And part of that is because of the stigma. The belief that if you're not doing high intensity, high prestige medicine, you're not a real doctor. The belief that lifestyle shouldn't matter. The belief that choosing work life balance means you're weak. And here's what I have to say about all that. Fuck that. Choose the life you want. Choose the specialty that lets you be the kind of person you want to be. And let the judgment roll off your back. Because in a few years, the people judging you will have moved on. They will have forgotten about you. But you will still be living your life. Make sure it's a life you actually want. Let's address another lie. You can have work-life balance in any specialty if you just manage your time well. You can have it all if you just prioritize correctly, or you can be a great surgeon and a great parent and have hobbies and stay fit and have a social life. No, you can't. Those who say they do are lying to themselves. Look, there are only 24 hours in every day, and if you spend 24 hours at the hospital on call, you don't get time for yourself or your family. That's just math. You cannot give 100% to a high intensity specialty and also give 100% to your personal life. It's impossible. Something has to give. For most people, it's the personal life that gives. The relationships, the hobbies, the health, the mental well being. Those are what get sacrificed. And some people are okay with that trade off. Some people want to give everything to their career. Some people find meaning and fulfillment in being all in on medicine. And that's totally fine. But be honest about it. Don't tell yourself you can have it all. Don't tell yourself you'll figure out balance later, because you won't. The specialty you choose determines the life you will have. So choose accordingly. Let me give you my honest take on the lifestyles of different specialties based on my experience, my observations, and my conversations with colleagues across medicine. Let's first talk about surgery, which could be general trauma or any of the subspecialties. Overall, lots of hours at the hospital, lots of egos. You can't ever be completely off because if one of your patients has a complication, even when you're not working, the patient is still your responsibility. In trauma and acute care surgery, well, it's high intensity, lots of call, unpredictable hours, but intellectually stimulating. Surgical subspecialties can vary. Some, like plastics or ENT, can have better lifestyle. Others, like transplant or vascular, can be brutal. The common thread is you're always on call for your patients, even when you're off. For emergency medicine, lifestyle is possible due to the shift work nature of most ER groups. You work your shift, and when you're done, you're done. The next person takes over responsibility for all ER patients. That's beautiful. You can truly be off when you're off. But you have destroyed circadian rhythms. One day you work in the day shift, the next you're on at night. Your sleep schedule is constantly disrupted. Your body takes a hit. Over time, that wears you down. There's only so long your body can take it. The good thing is that with seniority comes first choice in hours. If you stick with it, you can hit the day shift more often. Most ER groups I've known are pretty good at trying to soften the blow, but it is still hard on your body. What about internal medicine and its subspecialties? Well, it's lots of rounding, lots of intellectual discussions, lots of tweaking medications, and oftentimes the patients work against you. What I mean by that is compliance issues. You can create the perfect treatment plan, you can educate the patient, you write the prescriptions, and they simply don't follow through. They don't take their medications, they don't follow up, and then they end up back at the hospital. And that can be frustrating. For hospitalists, it's shift work, which can be good for lifestyle, but often brutal shifts like 7 on, 7 off with long days in between. Subspecialties like cardiology, gastroenterology, you can have better lifestyle in outpatient settings, but also procedures and call. Primary care, outpatient internal medicine can have reasonable hours, but often overwhelming patient loads and administrative burdens. Pediatrics used to be a great lifestyle specialty. Now it's harder because of the stigma associated with vaccines, which are a huge part of general pediatrics. You are constantly fighting with parents about evidence based care. You're dealing with misinformation. You're dealing with hostility. That can take a toll. Pediatric subspecialties vary widely in lifestyle, but general pediatrics, I would say, has gotten more challenging culturally. Dermatology, very smart people, great lifestyle, lots of money, focuses on outpatient care, predictable hours, no call, but highly, highly competitive to get into. One of the most competitive specialties in the match. If you can get in, it's a great lifestyle. Radiology also has a great lifestyle, except for always being inside a dark room in front of a computer monitor. No direct patient interactions for most radiologists. Somewhat competitive to get into, but great for those physicians who don't cherish direct patient care and are into technology. You're looking at images all day, making diagnoses, consulting with other physicians, but not talking to patients. That's either heaven or hell, depending on what you value. Anesthesiology, to me, kind of boring because most of it is being done by CRNAs nowadays, which still require doctor oversight, but one doctor can cover multiple ORs which are staffed by CRNAs. So you're supervising more than doing. That said, pain medicine is a subspecialty of anesthesiology where MDs still play a huge role, especially in interventional pain medicine. Think injections and other pain related procedures. That can be interesting and lucrative. Anesthesiology lifestyles vary. They can be good with no take home call, but you're still tied to the OR schedules. Psychiatry is probably relatively easy to get into, but you're not dealing with normal people most of the time. You're dealing with serious mental illness, personality disorders, substance abuse, trauma. That can be very interesting. It can also be very draining. Lifestyle can be good, especially in outpatient settings, but inpatient psychiatry can be challenging. And you're constantly managing risk, right? Suicidal patients, violent patients, patients who aren't improving. Finally, wound care, where I ended up. Not a recognized specialty yet, but it really should be. No nights, no weekends, no call in most settings. Can be intellectually interesting if you appreciate the complexity of chronic wounds. Pay is lower than high intensity specialties, but still reasonable. $150,000 to $250,000 per year, though I have known physicians make way more than that. Lots of autonomy in how you manage patients. Patients are awake and participating in their care, which I prefer. It can have significant driving time if you're seeing patients in nursing homes or home health, and some people find it boring. I find it sustainable. But let's talk about money here for a second, because compensation varies widely between specialties, and that's a factor in the decision as well. Here are some rough numbers. Trauma surgery, probably $400,000 to $500,000 per year on average. When I was doing trauma, I was employed by the Air Force, so I was making about $160,000 per year, far below the national average. But I also had my medical school paid for, so that debt was gone. Wound care, I would say, is about $150,000 to $250,000 per year, depending on location and patient load, though, again, I have known wound care physicians who make far in excess of that range, especially in private practice or with high patient volumes. Dermatology is $400,000 to $600,000 per year, especially in private practice. Radiology can also be $400,000 to $500,000 per year, but that depends on your location and volume. Primary care, roughly $200,000 per year, again, very much depending on location and patient volume. And the other surgical subspecialties, anywhere from $400,000 to $600,000 per year or more, depending on your specialty. So yes, there's a significant pay gap between high intensity and lifestyle specialties. Is that worth it? To me, the answer is no. I'd rather have a good lifestyle than a higher paycheck, but that's a personal choice. Some people just want to make a lot of money, and that's fine. Although there are probably better ways to make a lot of money than with medicine. But here's the caveat. The more money you make, the less freedom you generally have. The exception is private practice. Derm, plastics, functional medicine, or some niche specialty where you could have both high income and good lifestyle. But the trend is that private practice is dying. It's harder to make this a reality. And you would likely end up in an employed position before you spin off on your own anyways. The barriers to starting a private practice are mostly cost. You need to have a substantial financial cushion to survive the first few years to build your practice up to where it sustains itself. Most new attendings don't have that cushion because of medical school debt. So you work for someone else and you have less control. Let me address a related option, military medicine. I joined the Air Force through the Health Professions Scholarship Program. They paid for my medical school. In exchange, I owed them 3 years of active duty after residency. The financial trade-offs were such that medical school was paid for, $200,000 to $400,000 of debt erased, but lower compensation during active duty, $160,000 per year as a trauma surgeon instead of $400,000 to $500,000 that I could have made in the civilian world. Over 3 years, that's a difference of about $700,000 to $1 million in lost income. So, did the scholarship pay off financially? For me, yes. I only owed 3 years. And it also comes with other benefits, being able to get a VA loan for purchasing a house, military discounts at establishments, and possibly healthcare through the VA afterwards. But if you owe more years, the math changes. If you owe 7 years, you're losing a lot more income. For some students, military medicine can be a great career. For others, it's just a stepping stone out of debt. There is no right or wrong answer. I would definitely not talk someone out of it, especially if they were interested in military medicine and had a good exit strategy in mind. But I understand the trade-offs. Lower pay, less geographic control, military culture, potential deployment. Those are real considerations. So, how do you decide between lifestyle and high-intensity specialties? Here's my framework. Question 1. What do you value more, professional challenge or personal life? Be brutally honest. Some people genuinely value professional achievement and an intellectual challenge more than personal time. They'd rather be doing complex, high-stakes work than having hobbies or family time. And that's okay. If that's you, high-intensity specialties are a good fit. But if you value relationships, hobbies, health, mental well-being, if those things are genuinely important to you, then lifestyle specialties make more sense. Question 2. What kind of life do you want outside of work? Do you want to have a family? Do you want to be present for your kids? Do you want to have hobbies that require regular time investment? Do you want to travel? Do you want to have a social life? If the answer to any of these is yes, you need to choose a specialty that allows for it. High-intensity specialties will make these things very difficult. Question 3. How much energy do you have? Some people are just wired for high-intensity work. They thrive on adrenaline. They don't need a lot of sleep. They recover quickly from stress. If that's you, high-intensity specialties might work. But if you're someone who needs downtime to recharge, who needs sleep, who gets worn down by chronic stress, lifestyle specialties are a better fit. Question 4. How important is prestige to you? Again, be honest. If prestige matters to you, high-intensity specialties generally have more of it. Surgery, cardiology, neurosurgery. These have cachet. Lifestyle specialties often don't. People will judge you. They'll assume you couldn't hack it in a real specialty. If that bothers you, if prestige is important to your self-worth, factor that in. But if you can let go of external validation, lifestyle specialties offer freedom. Question 5. What can you sustain for 30 years? Not what can you do for 5 years of residency. What you can do for 30 years of attending practice. High-intensity specialties burn people out. If you're going to do one, you need to have a plan for sustainability. Either you're wired for it naturally, or you're going to burn out and need an exit strategy. Lifestyle specialties are more sustainable for most people, but they might not give you the intellectual stimulation or challenge you crave. Only you can answer these questions, but you need to answer them honestly, not based on what you think you should want, based on what you actually want. Here's what I tell students who ask me about lifestyle versus high intensity. It's a personal choice. For some, they need the high intensity life and thrive in medicine. They love the adrenaline. They love the challenge. They love the intensity, and they're willing to sacrifice personal life for it. For others, personal time and family is more important. They want medicine to be a career, not an identity. They want to have a life outside of the hospital, and they're willing to sacrifice prestige and pay for that. There really is no right or wrong answer in general. This should be a highly personalized decision based on everyone's unique circumstances. But here's what I want you to understand. Whatever you choose, own it. Don't choose a high-intensity specialty and then resent it for taking it over your life. That's what it does. You knew that going in. Don't choose a lifestyle specialty and then feel guilty about not being a real doctor. You are a real doctor. You're just one that values balance. Own your choice. Don't apologize for it. Don't second guess it. You made the decision based on your values. That's taking ownership. That's extreme ownership. Now, are there any sweet spot specialties? Specialties that offer both intellectual challenge and reasonable lifestyle? Yes, but they're rare and competitive. Here are a few. Wound care can be intellectually interesting if you appreciate the complexity, and lifestyle is excellent. Emergency medicine. Shift work means you're truly off when you're off, but circadian rhythm disruption is real. Critical care can be intense, but often has predictable schedules, and you're dealing with complex, critically ill patients. Cardiology, GI, pulmonology, and outpatient settings can offer good balance. Dermatology, if you can get in, is the holy grail of lifestyle and income. Radiology, if you're okay with minimal patient interaction. Psychiatry, especially outpatient, can offer good lifestyle with meaningful work. But understand something. Even these specialties have trade-offs. There is no perfect specialty. There's only the specialty that is right for you, based on your values, your personality, and your life goals. Here's my advice. 1. Take lifestyle seriously in your decision making. Don't let anyone tell you it shouldn't matter. It matters enormously. 2. Be honest about what you value. Not what you think you should value, but what you actually value. 3. Don't believe the lie that you can have it all, because you can't. You have to choose. Choose consciously. 4. Talk to physicians in different specialties about their actual lives, not during residency, but ask them about their lives as attendings. How many hours do they work? How much control do they have over their schedules? How much are they truly off when they're off? Do they have time for family, hobbies, health, etc.? 5. Consider your future self. You might be able to handle high-intensity medicine in your 30s, but can you handle it in your 50s, your 60s? Choose something sustainable. 6. Ignore the stigma. People will judge you regardless of what you choose. Choose based on your values, not their opinions. 7. Remember that you can pivot. If you choose wrong, you're not stuck forever. You can change specialties. You can change practice settings. You can leave clinical medicine entirely. You always have options. 8. Build a life outside of medicine. Regardless of what specialty you choose, you need an identity outside of being a doctor. Hobbies, relationships, interests that have nothing to do with medicine. That's essential for sustainability. 9. The money will work itself out. Don't choose purely based on compensation. All physicians make enough money to live comfortably. The difference between $200,000 and $500,000 a year is not as life-changing as the difference between having a life and not having one. Finally, take ownership of your decision. Whatever you choose, own it. Don't be a victim of your choice. You made it. You live with it. And if you need to change it, you change it. That's extreme ownership. I was a trauma surgeon. High intensity, high stakes, intellectually stimulating, exhausting, all consuming. And then I became a wound care physician. Lower intensity, more predictable, better lifestyle, more sustainable. And I don't regret the transition because I got my life back. I got time with my kids. I got time for my relationship. I got time to build a coaching business. I got time for this podcast. I got time to be more than just a doctor. That's what a lifestyle specialty gave me. Now, not everyone wants that. Some people want to be all in on medicine, and that's fine. But I needed balance. I needed a life outside of the hospital, and I chose a specialty that allowed for that. You need to make the same decision consciously, honestly, based on your values, not anyone else's. Lifestyle matters. Don't let anyone tell you it doesn't. This is In Search of 42. I'm Dr. Felix Becker, and your life outside of medicine matters just as much as your career in medicine. So choose accordingly. If this episode resonated with you, hit that like button and subscribe. Leave a comment about your thoughts on lifestyle versus high-intensity specialties. What matters more to you? What specialty are you considering, and why? What questions do you have? And please, let me know what else you want to hear about. As always, I will see you in the next episode.